Welcome, everyone, and on behalf of Ethnic Media Services and the Office of Community Partnerships and Strategic Communications, or OCPSC for short, welcome to today's last of 3 statewide news briefings to track the onset of extreme heat in California and what key state and local agencies and community-based organizations are doing to help people and localities adapt. Today, we'll look back at the summer of extreme heat, which broke records around the country, but not so much in California. We got a reprieve, according to the national media. Well, tell that to some of the places that felt very extreme heat. But why was that, and what does it mean? We'll hear from a public health official in one county about the impact of heat and, above all, of effective public messaging about its impact and how to protect oneself from it. And we'll hear success stories as well as challenges from community-based organizations charged with raising public awareness and, above all, building more resilience among communities. We welcome today's speakers, who include Braden K., Extreme Heat and Community Resilience Program Manager for the Governor's Office of Planning and Research, and he is back by popular demand. Dr. Maggie Park, also back by popular demand, County Public Health Officer, San Joaquin County Public Health Services. And we welcome new speakers to our briefing, Dr. Inés Ruiz-Huston, VP of Special Programs and Civic Engagement for El Concilio. Patrizia Hironimus, Executive Director at Butte Environmental Council in Chico. And Susan Henderson, Executive Director for Disability Rights Education and Defense Fund. We ask speakers to speak slowly for our interpreters in Spanish, Mandarin, and Korean, and we ask reporters to enter questions in the chat. Speakers, please monitor these questions as you can and respond on chat where you feel so inclined. We will be sending a video of today's briefing and expanded bios with contact information for each speaker to all participants later today. We thank OCPSC, Office of Community Partnerships and Strategic Communications. I think I finally got that down, and its partnering agencies for their valuable help in organizing today's briefing. And now let's start. Braden K. has to leave us after his presentation. He may come back at the end of the hour, but we will ask questions of him after his presentation, and then we will have our 4 succeeding speakers and hold questions either for the chat or for the end of their presentations. Mr. Braden K., he will make sense, we hope, out of California's summer of extreme heat, how the state is doing in building resilience, especially in underserved communities, and preparing for a hotter climate ahead. Mr. K.
Thank you so much, Sandy, and thank you all so much for having me here today. So I'm Braden K. I am part of the Governor's Office of Planning and Research. We have a team that supports local communities in climate work called the Integrated Climate Adaptation and Resilience Program. And we have a variety of programs within that, including this brand new extreme heat and community resilience program. And our team will be working very closely with the Office of Community Partnerships and Strategic Communications. And then our program itself will have $118 million to help grant out to tribes and businesses and local jurisdictions wanting to work on extreme heat. So I'm here today to talk a little bit about this summer and help put in context some of the work that's been happening in this all of government approach that California has to extreme heat. And so there's no question that extreme heat was across the national headlines this year, both across the world and across the United States. California did spare the brunt of a lot of this extreme heat. We did not see the type of extreme heat that we've seen in previous summers in the Bay Area and in Los Angeles in terms of headline-reaching extreme heat events. But we still absolutely saw extreme heat in certain parts of California. And then one of the great things in terms of the communication that has been coming out of the state and as part of this workshop series is it's really important to understand that heat deaths, heat illnesses, impacts to extreme heat don't just happen on the headline catching days. These health impacts are happening throughout the summer. We're even starting to see heat-related impacts happening in the winter in California at times. So what we know overall is climate change is making extreme heat more frequent, more severe, and longer lasting. Summer heat waves can be dangerous, and to this point, especially for young children, older adults, people with chronic diseases and disabilities, outdoor workers, people who are unhoused, and those who are pregnant. And you can see heat impacts in certain areas in those populations on days that are even above 85 degrees in a place like the Bay Area that doesn't have a lot of air conditioning. You can see heat impacts across the state in those populations in any day over 90 degrees. So what we know is it's not just, I think sometimes we have this challenge of the media paying attention to the record-breaking days and what the temperature is in Death Valley on a particular summer day. But when it comes to protecting people and making sure that people are surviving and thriving during climate change, we have to have responses to these health impacts that are happening, much earlier in the summer than in the spring than they have, happening much later into the fall than they have. So there is this sort of focus on really hot days in June and July and the impacts that those can have, but we really need to be telling the story and understanding extreme heat as something that's happening not just even in the summer, but the entire summer into the spring, into the fall, and affecting communities across California, not just on those heat days. In terms of this rest of this year, there is always the possibility of second summer. The 2-week outlook doesn't look like for the majority of the state there will be a lot of heat risk. So you can always go to heat.gov and look at heat resources there. The National Weather Service also has a heat risk tool where you can see what heat risk is being experienced across the state. And that's a great one to be able to use and be able to make sure that your readership or your audiences are aware of. So what we do know is that, given that we didn't have the types of impacts that we will continue to be having, this was really a summer to build on community resilience, to watch what happens when we're creating those community connections, when we're getting that kind of information out to people from trusted messengers. And that's what's so wonderful about what you're going to hear from the speakers today is many of the speakers today were partners in the Heat Ready program with the Office of Community Partnerships and Strategic Communications, and they have really important stories to tell in terms of the type of work that needs to be happening across California to ensure that people have the information they need, that people are staying connected to each other, and that when climate disaster strikes, whether it be heat wave or other risks, that we're ready. And so, I think we did make really meaningful progress. It's on the extreme heat preparedness side with the Heat Ready California program. More than 120 community-based organizations became funded partners and were activated to prepare their communities for extreme heat this summer. Advertising and outreach helped to increase awareness as to ways to stay safer from heat and focused on hard-to-reach and vulnerable populations. Some of the stats that the Office of Community Partnerships and Strategic Communications has collected. The campaign's paid media effort reached more than 38 million Californians across print, online, and digital channels in 9 languages. That language justice component is so important. In addition, teams have been working with media throughout the state, including the publications on many of who here are on this briefing, and you've been able to hear directly from the office, but also from doctors and other important leaders in the community about ways for Californians to protect themselves and their families from heat. We've had nearly 500 news stories with 26 million media impressions. And then we're continuing to work with notable influencers to make sure that we've had over 500,000 people reached with tips for mitigating extreme heat through our notable influencer program that the Heat Ready campaign has employed. So we know that we've had successful outreach with Heat Ready California, and that we've been reaching vulnerable populations, and you're going to get to hear some of those stories today. Before questions, I do want to give you a little bit of context in terms of what is coming ahead. And, I think one of the challenges with climate change is that it's not just change, it's chaos. And what chaos means is that it's not a linear path that every summer is going to be hotter. It's going to be very unpredictable as to what kind of weather we get and when we get it. And so I think that there's this challenge in the policy space where folks are like, well, you said it was going to be hot and it was less hot this summer, and I'd love to be in an ongoing conversation with all of you. How are we able to describe to people that climate change doesn't mean climate change, it means climate chaos, which means unpredictable change, which means sometimes it's going to be cooler and sometimes it's going to be hotter. What we know about what the future is going to bring is it's going to get hotter and hotter and hotter. It's not going to necessarily be linear every summer, hotter and hotter, but the general trend is getting hotter. And so we have this challenge of being able to communicate how we create an increased urgency and increased preparedness for extreme heat when we're not necessarily going to get that headline shattering extreme heat every single summer. And so that is a challenge of how we support Californians in doing this work, with knowing that it's, that the shock is unpredictable and we're not always going to know when that sort of mega headline hitting extreme heat wave is going to come. And it's part of what you all are working with is there's going to be misinformation. There's going to be people out there in that say that, oh, we had a cool summer, it's no longer a problem, or have other types of misinformation around extreme heat. And it's really important that you use us as a resource, you use the National Weather Service as a resource, there's NOAA as a resource, there's so many resources, there's multiple state agencies, including the California Department of Public Health, that can help make sure that we're making those informed, understanding communications around what extreme heat is and what it does. So we know, yep.
Could I, just because of time constraints,
Yep.
you have traveled all across the state. Is there, and you've also spent years in Phoenix dealing with extreme heat. Is there one example that sticks out in your mind, either of a resilience, a program building resilience, or a way of measuring the effectiveness of programs building resilience that you can share with us?
Yeah, I love that question, and I think there's two examples I want to give of work that I saw in Arizona that excites me for what I think there's potential for here. And one of those, and we've just recently seen this, we had several members of the Office of Community Partnerships and Strategic Communication go to a mobile home community in Yolo County and start to understand what the impacts of extreme heat are on mobile homes. In Arizona, there's been a lot of work to start to address mobile home communities and extreme heat. They have now warning systems that are helping mobile home communities figure out how to have even temporary trees in front of their homes, figure out electricity solutions, air conditioning solutions, how to harden the mobile homes so that they're more energy efficient so they can survive a heat wave. We know that there's a real need to support mobile homes during extreme heat. There's examples of in Arizona community-based organizations and Arizona State University and other partners really starting to tackle the mobile home challenge. I think I'm really excited for the potential to see those types of understandings of who lives in mobile home communities in California. How are we making sure that those communities are getting the resources they need to stay connected, to make sure that they have everything they need to stay secure in mobile homes. So that's one example of a huge need for community resilience and making sure that resources are going to a vulnerable population that really does have a very hard time in extreme heat waves. Another sort of larger infrastructure example is from the city of Tucson, where they're really starting to change how they capture stormwater and change their physical environment. And so that's another important thing to understand about community resilience. There's one side of it that is the people side. How do we stay connected? How do we make sure that people are getting the resources they need in a very short-term sense? Then there's the longer-term change of how do we create resilience to extreme heat over decades by actually making cities cooler. And so the city of Tucson has a storm to shade program where they know they're in a drought, they can't overly rely on water, and now they're have a funding stream and policies that support capturing that storm water and on the street, having curb cuts and different ways of getting that water to trees and vegetative materials, and they're cooling neighborhoods across the city with this technique. They've been doing it it started in one neighborhood in Tucson, and they've been doing it for several decades now. So there are some exciting examples in Los Angeles and in San Diego of people starting to understand the power of getting rid of pavement and of cooling communities. We've seen some really cool work with Pacoima Beautiful, who's been doing that kind of green stormwater infrastructure and use of cool pavements and use of trees to cool their neighborhoods. So we have some good examples both outside of California and within California of communities understanding, hey, we can't just do this every summer, grab a fan and make sure people are cool. We need this longer term infrastructure approach.
Right.
So that's another exciting piece of this work.
Okay, I have to break off here to go to our next speaker, but your enthusiasm and I know your experiences from Imperial County to Butte County to everything in between and to the east is extremely important. If people want to follow up and do one-on-one interviews with you, are you available?
Yes, I can be available.
Okay, terrific. Then I want to go next to our speaker from San Joaquin, Dr. Maggie Park, County Public Health Officer, Public Health Services, based in Stockton. And I asked Dr. Park to give a public health officer's our officials' perspective on how extreme heat has impacted the health and well-being of communities in San Joaquin, what steps public health services has taken to mitigate heat that she thinks worked best, and lessons learned for moving forward. Huge, huge request. Thank you, Dr.
Thank you, Sandy. Thank you for having me. I want to start off by talking a little bit about our county. San Joaquin County is a mix of urban and rural areas with a population of about 750,000 people. 88% of the land is rural, but only 8% of our population live in those rural areas. We have a large urban core, with the largest city being the city of Stockton, and several smaller cities, and we are multiculturally diverse. In fact, Stockton was deemed the most racially diverse city in America by US News and World Report in 2020. 14.5% of our residents do live in poverty. The county's public health department, where I'm at, is located in Stockton. Every year, as summertime approaches, our emergency preparedness and communications teams put out our usual messages on summer safety. Things like swimming pool safety, sun protection, advice on staying safe in the heat. Our website and social media messages remind people of the real danger of heat-related illnesses. For example, we use infographics that teach the warning signs of heat exhaustion and heat stroke. Public health is about prevention, and heat-related illnesses and deaths are preventable. So we do lots of education and lots of practical advice. Stay in air conditioning, wear protective clothing, stay hydrated. And it may seem like we have the same obvious messages on repeat year after year, but it's important that we say them over and over again. This past summer of 2023, as we were releasing our usual messages, the public was simultaneously hearing lots of news about extreme heat, and our messaging became all the more important. The Central Valley is already known for being hot, but we saw record temps this year. Stockton had a record high of 115 degrees. People had already felt the hottest July 1st on record when Stockton got up to 109. So when we told them that the heat was coming back, people paid attention. We had our consumers really use our social media posts, share them and repost them. And we knew we had to up our game and start teaching more about extreme heat, taught the public how to look at the National Weather Service heat risk forecasts, for example. I said that public health is about prevention, while we're also about health equity. And you asked me, Sandy, what were the impacts of heat on health? It's difficult to measure direct impacts of heat on the health of individuals. We just don't have that kind of data yet. But we do know that according to research from UC San Diego School of Global Policy and Strategy, that low-income neighborhoods and communities with higher Black, Hispanic, and Asian populations experience significantly more urban heat than wealthier and predominantly white neighborhoods. This is because poor and minority groups live in areas with more buildings, more concrete, higher population density, less vegetation, less trees, less heat absorbing surfaces. So even within the same city, the heat burden is not shared equally. We do our best to get into those communities and reach those who are most at risk within those communities, like our older adults, people with chronic medical conditions or disabilities, pregnant women, and infants and young children. And we rely on our community-based organizations such as El Concilio to be the trusted messengers in these communities, places where we know the impact of heat is going to be the greatest and where the heat presents special challenges. We set up cooling centers all over the county, in every city, and all of them were ADA compliant for access and functional needs, and they accepted service animals and were also willing to address the needs of people who had personal pets. In our county, our system was set up such that our local RTD bus system provided free transportation to all of the cooling centers. So we really tried to make it as low barrier as possible to get to one of these centers. Our county's Office of Emergency Services works hand in hand with public health, their OES, and they make sure that the list of our cooling center locations is constantly updated and shared with 211. And we rely on our local journalists to push out that information for us. Our homeless population faced unique challenges during the heat surges. According to a 2022 point-in-time count, we have 2,319 homeless individuals in San Joaquin County, 1,355 of them being unsheltered. We know that these folks don't really want to leave their tents and all of their belongings behind to go to a cooling center. It doesn't actually work for them. The staff go out to teach them, and we go into their spaces to give them valuable lessons on how to store food properly, how to avoid storing dairy and eggs, and the proper disposal of rotten food. We take them frozen bottles of water that serve a dual purpose of keeping food cold and then being available to drink later. And there's a mobile shower unit called Showered with Love that travels throughout our county, helping the homeless people stay cool and clean. Of course, there's other challenges as well. For example, language barriers. We have a lot of agriculture here in San Joaquin Valley, so lots of migrant farm workers working outside. And we rely again on our partners in the community and our ag businesses themselves to ensure that those workers don't work during peak heat times and drink plenty of water and wear protective clothing. But getting materials and education to them translated into their indigenous languages is an ongoing challenge. And not only is language important, but the message that we give to the public is important and has to be clear. You know, during COVID, we told people that outdoors was safer than indoors. And then during the heat, we said, go to the mall or go to the library and stay indoors for the air conditioning. So we founded a balancing act where public health really had to be clear with our messaging and explain to the public when staying cool might have been the more important choice. Looking to the future, there's lots of ongoing efforts taking place and taking shape in San Joaquin County. We know from studies that low-income residents use only moderately less electricity, pretty much the same amount of electricity as higher income households. So they end up with a disproportionate share of the burden of the cost and the consequence of that. Our County Human Services Agency assists people with the Home Equity Assistance Program, or HEAP. But in addition to helping people with their energy bills, there's a lot of more proactive programs, the type of things that Braden K had just talked about. Again, I'll use the city of Stockton as an example, where the city's efforts include a transformative climate communities program, which they're calling Stockton Rising, where they're installing rooftop solar panels, providing energy efficient appliances, and creating treetop canopies in high need areas of the city. OES is currently developing a project with a couple of our community-based organizations where they're looking at older homes in Stockton that don't have air conditioning or have windows that are painted shut. Even for some people in those older homes that do have windows, although they were used to opening those windows to get the Delta breeze in, now a lot of them are closing them because we're warning them about poor air quality coming from regional fires. And some folks just choose to keep their windows shut because they're concerned about their safety. So these programs are looking at installing air conditioners for these residents that will have backup generators that will stay powered even during power outages. Public health leads our county's community health needs assessment, and our epidemiologists put together a list of priority neighborhoods. This year, we developed 14 census tracts, and our community health improvement plan, which we work on with our healthcare partners, health plans, universities, is going to build on these priority neighborhoods. Specifically, we're looking to rejuvenate our parks and increase our urban green spaces. Our schools also are really transformative, with many of our districts making sure that they have covered playground structures for shade. They're scheduling plans so that the kids come out of the heat and do innovative PE activities indoors, and they're making sure that kids have fresh water available. You know, during the heat surge, CDPH put out guidance for schools and coaches on sporting events being held during extreme heat, and we follow that very closely. I also want to say that I sit on the county's.
Dr. Park, I have to ask you to wrap up just because of time constraints. It's fascinating. Sure. Thank you. Can you say one last thing? I'm so sorry to cut you off.
No, I understand. I wanted to say that right now, this disaster council is looking at the county's emergency plan, and we're adding severe weather hazards to that emergency plan, and we're probably approving that. And that really governmental agencies need to be doing more of that kind of work. Innovative things, looking for funding, and I'm hoping that in the future, this data that I'm talking about that's missing is going to be more involved and more available through syndromic surveillance, where we can talk to hospitals, see who's showing up in our healthcare systems for heat stroke and heat exhaustion. And so hopefully the more data we have, the more we can share with our communities. Thank you, Sandy.
That was just tremendous. And now we're going to go to a leading community-based organization in San Joaquin and neighboring counties, Dr. Inés Ruiz-Huston from El Concilio in San Joaquin. I'm not going to summarize because we're running
No,
short on
thank
time.
you.
Okay.
Thank you for the opportunity. And Dr. Park, this is one of the key things about community-based organizations. We must work together with our public community, our public health. They're key to keep us in tune. And for us to be successful, as Dr. Park said very clearly, is the opportunity to do correct messaging that is in multiple languages, and it does not hurt. The best form of communicating to our community is door to door. It is special events. You know, everybody loves a good party. So when you do a party or throw a party, that's when you educate the community. Make the topic about extreme heat and you turn it into something exciting to talk about, something to share information with one another. And also use the opportunity when we found out through Dr. Park and her team, you know, use public health, your county public health and the state to provide the information for you. We immediately created a video. Lots of times, just people watching videos through social media can also help them understand what to do. And what we did is we combined the opportunity that RTD provided free transportation to a cooling center. And that provided lots of hits, lots of views, lots of shares because the families wanted to know about that. And of course, we had that also in multiple languages. So that way people could hear it or listen to it. We know our families go out to work very, very early in the morning. They may miss that morning news or how hot is really going to be. But whenever they take a little break to and from, they're doing a little this and this and this, which means, you know, looking up the social media or the platforms. The head of households tend to relay the message that I heard from here, the trusted messenger. This is an opportunity. What we also learned from extreme heat, and we've done when we go door to door, knocking on families about what are some of their concerns or needs. A lot of our families are worried about the cost of electricity. They're afraid to run that air conditioner unit, or that all of a sudden, because everyone's running their air conditioner, the whole system will go out, right? An outage will come out because everybody's pumping their air conditioner unit. So everyone is really conserving at the detriment sometimes to their own health. So we got to let our families know, either, you know, collaborate and go with somebody in the home that is cool, or take the RTD bus, make it an event to get to the cooling center and you all hang out at the cooling center, or find the resources. There's been many times, like I said, that, you know, boots on the ground is the most effective messaging. Did you know 2 blocks away is your cooling center? You can go there. Oh, can I? A lot of our families do not know that community centers are accessible to them. And they don't know that this is a free and welcoming place. So it's our job through social media, through videos. Like I said, we love what OCPSC has done with infographics that we also gave to people to read about the extreme heat. What are the signs, seeing the temperature rise, whether it is hot going into the head, what to do, drink lots and lots of water. We use different people to provide those messages in multiple languages. So when they see that with Instagram or Facebook or other places, oh, look at that, I know that person. Share, right? Share that information. So these are some outlets, some things that we've learned and we'd like to share with one another, and also about taking care of one another. But we are worried because people don't want to turn on those air conditioner units because of the cost. And so they tried, and I was just let it blow a little bit because you all are getting way too hot in here. So if we can share that with one another, provide the information. Again, these are the outlets that can help our community. As we know, sometimes flyers or mailers aren't enough. What is the best? Find your team that likes to be, find your representatives in your neighborhood that are your talkers. Let me tell you, the neighbor lady that knows everything about the community is their best lady to tell everybody what's going on and what they need to do to take care of one another. That's my message.
Could I ask you
Yes.
one key question?
Yes.
What do you see? What are your biggest concerns looking ahead? You had mentioned rain, but it may not have filled the aquifers. You had mentioned the electricity overload and the fear of people to pay high costs for electricity in order to have air conditioners. But you had mentioned that air conditioners were also not quite up for the extreme heat, that they weren't very energy efficient. What are your best recommendations going forward?
I think going forward is we need to better way to communicate with families and those that have access to the air conditioners or whatever, what programs are out there so our families can be more energy efficient, or connection to the solar panels and all that. I think we're starting to have those communication coming out there, but they're afraid or not sure of. So one of the things I think that we can help or promote is how can we, they get afraid the cost is so high to change an air conditioning unit, or, to even turn it on with electrical grid. Thank you, somebody who just corrected us on that. Electrical grid getting over capacity because everybody has it on. So, everyone, more than anything, our families are trying to save money, and cost is one of the major issues of fear of turning it on is that. So I think what we can do is, what are social programs out there that what we learned we need to look for, so people can sign up for it and know that they're not going to have this huge bill at the end. Because sometimes there are people out there that, oh, you did this, great, now here's your bill. I'm like, what is this about? So we need to find out and help what are the correct resources so our families can have the proper support systems to change the systems, and also when are the best times to actually have those units run and when to turn them off, because of the energy efficient time as well.
Thank you, Sunita. I'm going to go on to our next speaker. Perhaps you could address Dr. Ruiz-Huston on the chat, but we're running short of time. This is such a rich presentation by our speakers. Let me ask now for Patrizia Hironimus, Executive Director of the Butte Environmental Council in Chico, for your success stories of building resilience in a very challenging area of the state. Thank you, Patrizia.
Thank you for having us. Yes, we are pretty nuanced here up in Butte. We have a great population of fire survivors as our community members out in the foothills. We also have a lot of students due to the Chico State University being so local, and Butte College. So our particular challenges with the extreme heat campaign have centered around a socioeconomic lens of equity, trying to bring a weatherization awareness that students can employ in their rented apartments, their shared housing. We did a workshop on providing a film shade instructional workshop, how to cut cardboard to reflect some out of your windows. And these are just things that we can do as community members to keep each other cool if we're in shared housing situations. Also, exactly like Inés said, the high cost of electricity and keeping your house cool or apartment cool. If you're lucky enough to have an air conditioner here in Chico or Butte County, then yes, finding the money to run it and pay that $300 bill every month in the summer is taxing at best. So we had some challenges in the populations we serve. We threw a Beat the Heat event with pool and vendors like North Valley Harm Reduction, Safe Space Cooling Center. We invited Butte Glen 211, which is helpcentral.org. who was instrumental after the campfire, providing resources to fire survivors. So we really leaned on our partnering community-based organizations to do that trusted messenger outreach through social media, Instagram, Facebook stories. We did PSAs on extreme heat weekends and told people, hey, it's coming, be prepared, make a plan, check in on your neighbor, here are the warning signs. The state was great at giving us material to distribute in Spanish and Hmong, because we do have a very population here in Butte County. And we had some disaster resilience programs already set up from the North Complex fire, which is also known as the Bear Fire, and some food pantries that have been set up and running since the campfire, and those have always been tacked. So knowing where to provide extreme heat information at disaster ready summits was very important for us to get our trusted messenger network really dialed in, and our community-based organizations on the same page as us, and saying, hey, can you distribute this information to your population you're serving? We dropped the flyers off the door knockers that had the information. One of the challenges we experience in this campaign is the heat itself. So we're talking about I think it's called the urban heat island effect, when we have the radiant heat off of the pavement. And so we wanted to participate in the Downtown Business Association Thursday night market to do outreach and education. But if the temperature of the pavement is 105, it's going to go up past 110 because it's been sitting there in the extreme heat all day. So we can't ask people to table and let our community know about the warning signs of extreme heat in the extreme heat, because it's a cognitive dissonance. If we're saying don't be out there if you're above a certain age or if you have comorbidities, and then we're out there saying this information. So we really had to get creative with safe space, cooling center. To your point, I know we have to cut down on time. I'm just going to get to looking forward, where we see this intersectionality affecting most extreme heat affecting most of our population is in the food sovereignty realm. I think we are in some frontier county here in Butte County, and so it's already hard enough to get fresh vegetables and fruits up to the Burn Scar area. We have a market mobile through Butte County Local Food Network, and some of this extreme heat will exacerbate our already strained food distribution routes. So going forward, I think our disaster ready summits need to plan for the food distribution element of how this climate is affecting our patterns of getting food to people. And that's just one of the things that comes to my mind. Butte Environmental Council has been great about planting trees in schools and community places through our Trees Please education programs. We go into the schools, we plant trees in community spaces and schools to offset the urban heat island effect in the cities. And we would love to implore the Climate Action Commission in the city of Chico to start holding regular meetings again, because they have paused this summer during the hottest summer that we have. But there is an extreme heat event preparedness plan that we would love the Downtown Business Association to get on board with, and start finding some alternative spaces for commerce to happen during these extreme heat situations. Not calling people out into the asphalt streets of downtown, but really providing maybe a place that is cooled for people to shop. So it seems to be a win-win when there's a public-private partnership. Go ahead.
One question that comes from one of our media is about the very punitive attitude that has happened in Chico towards homeless encampments.
Mm-hmm.
And yet homeless people are very much on the extreme risk list for very hot weather. how have you been able to address the very large homeless encampment population caused by the fires of recent years?
So we have been working in conjunction with the city of Chico when there have been city sweeps that have occurred, like the recent one in Depot Park. It has moved our unhoused population closer to the waterways in Chico State University. We just did our 36th annual Bidwell Park Creek cleanup and restoration project. So we had over 500 volunteers come out and pick the trash and furniture and organic materials, everything out of our waterways in both Orville and Chico creeks and Feather River. And this is twofold. It's to give salmon the best possible chance of survival and to keep our waterways clean. So Butte Environmental Council has asset mapped places to get into water to cool down in extreme heat situations. We have that on our website. We also have Free the Food stands for food sovereignty. But what we're trying to do is close that equity gap between where people can cool off if they don't have money for electricity or they don't have shelter to keep cool under. If they're outside, there is transportation to Safe Space Cooling Center. We are partnering closely as far as messaging is concerned and offering them all of the Office of Planning and Research information that is coming through. So we're working very closely with Safe Space and our most vulnerable population. And we would love more support with Butte County Public Health in addressing the other disaster that is the unhoused population.
Thank you so much, Patrizia. Sure. I'm sorry to cut you off.
No, it's
but let's go now to Susan Henderson, Executive Director of Disability Rights Education and Defense Fund, to hear about the extreme heat and the threat it poses, particularly to people with disabilities, and what her agency has found were effective ways, success stories, if you will, as well as challenges with dealing with a very sizable but often invisible population, people with disabilities. Thank you, Susan.
Thank you. Thank you all. Thank you all. It's great to be here and to have this opportunity to learn from all of you. So thanks for that. Yes, I'm Susan Henderson, the Executive Director at what is fondly known as DREDF. DREDF is a national nonprofit law and policy center led by people with disabilities and parents of kids with disabilities, and we're dedicated to advancing and protecting the civil and human rights of disabled people. So just a little bit of background about disability itself. The Centers for Disease Control estimates that about 1 in 4 people in the US have some kind of disability. And a large portion of that number are older people. So pretty much all of us age into disability. So when we create access for disabled people, we're also creating access for older adults and frankly, everybody. Disabilities can be invisible and dynamic. Disabled people and older adults have a lot in common, and we have intersecting functional needs. There are also tremendous attitudinal barriers toward older people with and without disabilities, and also toward people with disabilities. So, like Sandy asked, what are some of the challenges that disabled people faced in extreme heat? These are just a couple, and they're shared with the populations that have been spoken about earlier. Safe, accessible housing with air conditioning. Housing infrastructure and accessibility are priority issues and deeply entwined with extreme heat challenges and the well-being of disabled people. Transportation, accessible transportation when needed to get from our homes to cooling centers or healthcare centers, along with our mobility devices. We can't leave those behind. Accessible cooling centers can be a challenge. And then also, like the other folks mentioned, power outages. So for people with disabilities, electricity and power supply are critical, and especially in times of extreme heat and wildfires and other natural disasters, because many of us are dependent on medical devices and air conditioning that need power for us to stay well and alive. We can't, if you're using a ventilator that requires electricity,
Mm-hmm.
If the electricity goes off, you either need a backup power or you're in a lot of trouble. So we are one of the groups that has been working with the Office of Community Partnerships and Strategic Communications. And so what worked best during our campaign this summer? Frank, working at the state and local agency levels has always been critical. It's what TriDF does best. And we worked with OCPSC to make sure that there's some planning for inclusion, including disabled people in that planning, because if we don't, it's likely not to happen. So working with the OCPSC was a huge leap for all of our communities, I think. Having these us as trusted messengers to reach out to people was really a plus. Just like on this webinar, the plan included interpreters for languages other than English. Planning for access inclusion also has to happen. So what did we do to meet challenges in the campaign? Like I mentioned, we communicated the needs of disabled people to the state. So its response would include disabled people and its communications would include disabled people. For instance, we collaborated on a focus group of people with disabilities to hear about their unique needs, and the state learned a lot, and so did we. The second thing that was pretty successful is we collaborated with the California Office of Emergency Services on a written guide on accessible cooling centers. So a little more detail about these two things. The focus groups were held in April of this year, and with OCPSC and Root Change, another one of their partners. They were really great in modeling how to listen to disabled people and inform more inclusive plans that value the lives of and experiences of us. Those focus groups shed light on how the participants thought about extreme heat and climate change and how they behave when they're confronted by these kinds of events. So what are some of the things we learned? Again, housing inventory is limited, accessible housing inventory in particular, and also because we're in the Bay Area, there's not a lot of air conditioning. You know, we have been a cool area, so a lot of our houses don't include air conditioning. Renters said that they often bear the cost for adjustments needed to deal with extreme heat. So they had to buy things like air conditioners, window covers, and fans. And for disabled people and older adults on fixed incomes, the cost of air conditioning is too high, the units and the electricity. They often have to choose between electricity and other basic needs. And we heard this from other folks earlier. Particular to some people with disabilities, regulating body temperature can be a challenge, either due to spinal cord injury or different types of disability, and that can be very, very dangerous. People reported that transportation challenges during extreme heat, where they'd get dehydrated and limited availability of accessible public transportation, or even shuttles that were created particularly to go to cooling centers. Some folks were nervous that they would be a problem having timely access to emergency facilities if they became overheated or dehydrated. Participants shared that while disabled people are greatly affected by global warming, they do not feel that they are included in official planning processes. They're very concerned about representation and undercounting. Some of the behaviors or practices that disabled people used when in those extreme heat events were, like everybody else, using shade, using fans, seeking shade, wearing cooling vests, using spray bottles. They would continuously charge their medical devices because they were afraid of brownouts or blackouts. They left home to go to a library if they could get there, and often just getting into a vehicle or a van to take advantage of the air conditioning there. The second successful piece that issue that we worked on was with the California Office of Emergency Services, and we assisted in the production of an accessible cooling centers guide that would help ensure that people with disabilities and other individuals with access and functional needs, like kids, because their functional needs are different than adults, could be served equitably at cooling centers. And I'll share that link in the chat when I'm finished. One of the really important points that the guide makes is that planners and operations staff should be collaborating with resources in the community who already serve people with disabilities and older adults. And those would be like area agencies for aging, independent living centers, which are all over the state in every county, and really helpful, aging and disability resource centers, and also any community-based organization that knows their community best. What needs to be done? What still needs to be done? Well, there's a few things, but I'll focus on this. I think there needs to be accessibility audits of cooling centers, a thorough checklist developed and distributed and used by local locations that are having cooling centers. We've done similar things for medical offices to make sure that they're accessible to people with disabilities. Transportation in planning, make sure that that free transportation that's being offered is accessible to people who use wheelchairs and other mobility devices, and that they can take those devices with them. Training, staff and volunteers at cooling centers need to be trained to make sure that the cooling centers are accessible. They need to be trained on how to assist disabled people. And here's a quick tip: ask the disabled person what they need. And also how to respond to requests for reasonable accommodations when they come up. These are these are not difficult things for people to learn. So just wrapping up, I appreciate this opportunity to share some of our expertise and learn from all of you. And I'll hand it back to you, Sandy.
I really thank all of you and want to save our last few minutes for a couple of questions. One is, given that public education and public awareness was critical aim of this initiative we all have participated in around extreme heat, how would each of you say public awareness is now? Where are we with public awareness? And what would be the most important message for us to get out to our media about extreme heat moving forward? Let's start with Braden, but you have very less than 1 minute, 40 seconds. How have we done on raising public awareness, and where is the gap? What do we need to let people know? Braden? Let's see, let me come back to you and go to Dr. Park, but I'll definitely come back.
Sure. I think people are generally aware that heat really is rising, and that we're in trouble if we don't do something about it. However, the whole concept of climate change in general can be a bit politicized in our counties. And so I think we have some work to go on doing education on that front.
And what would you, when you say politicized, how do you mean?
Well, I think some people think that it's kind of a hoax. Maybe they really felt the heat this past summer and knew that it was real, but they don't really see that we are gradually shifting year over year to higher and higher temperatures, and really don't see the reality long term of this being a problem, and of humans being contributors to the problem.
Great. Braden, you're unmuted now. Sorry for the glitch.
Yeah, Maggie, that was so well said. I think it's going to continue to be important that folks are aware of what causes heat-related illnesses and what this work looks like. The stories that, Patricia's just told, and the stories that we've heard today, show you that there are people across California that are being impacted by heat. Just this morning, I was in a session with Cal OSHA that talked about heat deaths, one in a county just north of Sacramento, where it was an outdoor worker that hadn't worked outdoors in a year. His body wasn't acclimatized and passed away on a 100-degree day. Not the most extreme heat, but because his body wasn't ready for it, it didn't happen. Every heat death is preventable. That's one of the things I've learned from the California Department of Public Health colleagues that we work with. Every heat death is preventable. The question is, do people have the resources do they need? Do they have the information? And as I've gone across California, whether it's farm workers, in Tulare County, or really interesting farm worker organization that works with indigenous farm workers in Ventura County, or a recent visit to Calexico, what we're hearing over and over again is that people don't have the information they need. And something in the chat that was so important, this is not, I said this in the last press briefing, these are not your grandmother's heat waves. So many people are like, oh, it's hot here, but this is heat longer in the evening, earlier in the morning, earlier in the spring, later in the fall, over and over every summer. And this is not what you've experienced before. So there's a huge piece of this messaging that has to do to break down that understanding of people that experience heat, or people that think that are, able to experience heat because they're outdoor workers. But what we're seeing here is that this is not the heat waves of the past, and that we have to be prepared for a much, much hotter future, and that every heat death is preventable if we do a better job.
A very important message. Inés, Ruiz-Huston, how are we doing on the messaging front, on the public awareness front, and where's the gap? What do you want to see more of?
One of the things that concerns us the most is more languages. We need to have video messaging, speaking in multiple different languages, and video that people can share with others on multiple platforms. And the other thing is on the global side, in terms of language and messaging, is the WhatsApp app. That's where we know a lot of our community, it communicates with their families at home in other countries. But if we're able to, as getting access to that, to be able to put those in multiple languages, that would be wonderful for helping our families to be able to kind of, and video, it needs to be like in a video where someone's talking or sharing that information. Again, a lot of our families, doesn't matter what language the writing could be, they may not be able to read that, whether, especially with English and Spanish. We've learned through COVID, I think taught us, that's teaching us about extreme heat or any other messaging, that it does take videoing, talking, and door-to-door knocking.
Okay,
is still the best.
Okay, thank you. Patrizia, your thoughts about how public awareness has we've moved the needle, we're somewhere moving the needle. Where do we need to move the needle most? Sorry, you're still muted. I'm so sorry.
No, it was my fault. There was a fire truck going by anyway. Fire survivors, right on cue, are climate refugees. If anything we learned from Maui and what's happened recently is the total devastation of Paradise, California, and the island of Maui. We now have fire survivors. They are climate refugees because climate is causing erratic behavior in fire. It's causing torrential downpour. It's causing flooding in our farming areas. So just shifting that perspective and that mentality to care for our community prior to these climate disasters, just looking at it differently. It's enough to say, oh, here's a public safety announcement that it will be this hot on this day, but we need longer term planning for our hundreds and thousands of people who will become climate refugees in the next 5 years, 3 years, probably even year.
It's a very important message. Finally, Susan Henderson, your thoughts on, have we moved the needle? And if not, where do we most need to accelerate our efforts?
Well, to some extent, I think as we're all individually impacted by extreme heat, we pay more attention, right? So that's a good thing. I mean, and that bad thing, good thing, But as we move forward, I just want to remind us all to make our communications accessible. Remember that there's people who use sign language or captions to get their messaging and other ways, and make sure that when you're reaching out, you're showing you're being inclusive of disabled people and their families. Say the word disabled. It's a good thing, make sure that people know that they're included in your messaging.
Thank you so much for that. We did occasionally have people who could use sign language on our briefings, and you put that back on our absolutely top of the queue. Thank you so much for that reminder. I think we're at the hour. We're a little over the hour, but I want to thank our speakers, our media, and our interpreters for a very informative and significant third briefing of this series. And thank you to our partnering Office of Community Partnerships and Strategic Communications. Thank you all. This conference is now closed.